Hello friends, I'm Dr. Swati Kanakia, Pediatric Hematologist and Oncologist from Mumbai. This video is on a very common but important topic, Iron Deficiency Anemia. So let us start with what is anemia. Anemia means that the child has decreased amount of hemoglobin or the pigment which makes the human blood red in color. This could be due to numerous reasons, and one of them is the deficiency or lack of iron. So, how common is anemia? According to the National Family Health Survey 5, which was done in 2019 to 2021, 25% of men in the age group of 15 to 49 years had anemia. 57% of women between the age of 15 to 49 years had anemia. In the adolescent age group, 31% boys and 59% adolescent girls were suffering from anemia, and roughly 52% of pregnant women were detected to have anemia, and 67% of children between the ages of 6 months to 59 months also had anemia. And out of this, iron deficiency anemia is one of the commonest causes. So, why is iron so important for the human body? It is attached to the heme portion of hemoglobin, and it transports oxygen from the lungs to the rest of the body. In the muscles, it binds to a pigment called myoglobin, and this helps in the oxygenation of muscles. In addition to all this, iron is necessary for a lot of biological processes, and it helps in the neurocognitive development of a child. So, when there is a lack of iron, what are the symptoms? In other words, what are the symptoms of iron deficiency anemia? So, a child may have different symptoms. The child looks pale, which is the commonest symptom. Sometimes the parents come to us with this complaint that, the child is looking pale or is looking very whitish. Sometimes parents take the child to a doctor, and the doctor realizes or notices that this child is looking pale. Let's get a blood test done. The child may be irritable, may feel tired, may be listless, uninterested in surroundings. They refuse to eat, um, and they have delayed growth, um, and they have frequent infections. They may have unusual cravings for non food items, like let us say ice, like dirt, paint, starch. Um, I had a patient who would, scrape the wood from a table and eat it. So they have these kind of um, tendencies to eat. This is called as pica. Your baby is at a risk of developing iron deficiency anemia if the baby is born premature, has a very low birth weight, is exclusively breastfed without adequate weaning or starting, top feeds after 6 months of age. If the formula which is fed to the child isn't fortified with iron, um, for children between 1 and 5 years, um, these are the children who are at a greater risk of developing iron deficiency anemia. That is, children who typically drink large amounts of milk, either cow's milk, goat's milk, or even soy milk in a day. Those who have certain health conditions like chronic infections or they are on restrictive diets. Children who have been exposed to lead may have lead poisoning, which may lead to an iron deficiency anemia. Nutritional deficiency is one of the commonest causes, so children who don't eat enough iron rich food. But um, in our country, with a lot of vegetarian food, it is very difficult to get large amounts of iron, inside the body. Children who are very overweight or obese, children who are losing blood may also develop iron deficiency anemia. Adolescent girls are at a risk of developing iron deficiency anemia because they have a lot of menstrual blood losses, and some of them, when they get into these teenage years, they are on restrictive diets. They want, I won't eat this, I won't eat that. So this is what we call food faddism or diets, and they also tend to develop iron deficiency anemia. What is the treatment for iron deficiency anemia? It's very simple. Oral medicines are available, easily available. These are pretty simple medications and they are not expensive at all. What you as a parent have to do is ensure that the child takes the medicine or that you give the child medicine every day. Okay. The other treatment that is available is injectable iron, which we really in children we really don't need to give IV iron as we call it or intravenous iron, and by and large the oral iron does the trick. What are the side effects of iron therapy? So if you see oral iron, a lot of my patients will come back and say that we haven't given continued the iron because the child has constipation or that the child has diarrhea. Please come back to the doctor and tell them. The doctor will give you different strategies by which this can be prevented or it can be decreased. Uh, the stools turn dark or black because of the iron, which is quite all right. There's nothing to worry about it. Sometimes the teeth have some staining with iron. So if you advise or if you give the child a little bit of water, the staining of the teeth can be prevented. So, can iron deficiency anemia be prevented? Well, yes, definitely. So, at the level of the government of India has launched you know, something called as the Anemia Mukt Bharat. That's a nationwide strategy. At a personal level, um, for prevention, after the age of 6 months to 5 years, supplemental iron is recommended. So please ensure that if your doctor has recommended supplemental iron, then make sure that you give it to the child regularly. For children at risk, like in any of the above conditions that we spoke about just now in the last slide, those children should be supplemented with iron and folic acid. They should also be dewormed, and we also advise appropriate feeding practices to the child, including introduction of solid foods and uh, weaning and top feeds. So it is very essential that this nutritional advice is carried out properly. We also advise increasing the intake of iron rich foods and restricting the amount of milk that a child consumes in a day. Experts will tell you that you should cook in an iron kadai, and that also helps in preventing iron deficiency anemia. Thank you, friends, for watching this video. I hope it was useful. Please share it with anybody you think may benefit from it. It is part of an educational initiative by the KRK Foundation. The idea is to promote awareness about blood and cancers in children. Uh, it helps the parents to look after their child better, and somewhere we hope that this will translate into better health for everyone. Uh, Remember at all times that this video cannot replace the advice of your doctor or your pediatrician. Please make sure that you talk to them at all times. No part of this video can be reproduced without permission. Thank you, friends.